Hi there, I'm Erin. I'm an expanded function dental assistant, and I would like to talk to you about something that is pretty important to me in my line of work, and that is dental x-rays. A lot of people will refuse dental x-rays, or they're afraid of dental x-rays because they don't think that they're important, or they think that they're bad for their health. So I'd just like to talk about why x-rays are important for the dentist. So, what is an x-ray? An x-ray is basically just a little beam that is created from electrons going through an x-ray tube, turning into photons that goes through your tissues and imprints an image onto a receptor. Most places use digital, so it's instant and it's pretty accurate, and it has very low radiation, which is very nice. And how you read a dental x-ray: this is a bite wing. You can see the different densities. It's kind of like a gradient in the image. The hardest materials, which would be your enamel, show up as white because they don't allow the photons to pass through. And the softest tissues, such as your cheeks, allow the photons to pass through, so they are more present on the image when it's received. So this is your enamel, your dentin, the nerve of the tooth. This is your bone, and then here would be your gum and cheek tissues that are this black spot here. So how do we evaluate x-rays? What do we use them for? Well, one of the most important things that we use them for is cavities. And cavities can be shown as little dark spots on the teeth here. So there's a little triangle of darkness, and this is from acids acids and sugars reacting with bacteria that put more acid on your teeth and basically erode the enamel and other structures away. So once we see those, it's time for filling. One of the more other important things that we look for, I'll revert back to this picture, is periodontal disease. And we can see this in various ways. We can see radiographic calculus. This is hardened bacteria that's been on the teeth or underneath the gums for a long period of time. And when you see calculus here on the x-ray, you know, oh gosh, that's a lot. And how your body reacts to it is, since this is actually a bacterial infection, it pulls the bone away from it, and you can suffer from bone loss, which is better highlighted here. You have healthy bone levels right at the crown of the tooth where it is visible and the gum tissue starts. And then once you have all that bacteria making a chronic infection here, your bone starts to pull away and you experience bone loss. So that's very indicative of periodontal disease, and that's more severe because it is a chronic and systemic disease, so you have to maintain it more often than you would if you didn't have it, and it can also affect the rest of your health. There are a few different articles on that, but I won't get into that right now. Another thing that we use x-rays for is evaluating infections of the nerve of the tooth. So periodontal disease is a bacterial infection present in the gums and around the bone and different attachments to the teeth. And a toothache, if you know you're really feeling it, is indicative of infection of the nerve. So when you have a really big cavity like this, or you have trauma, or sometimes for no reason at all, your nerve will die, and it has created an infection in the bone where that nerve meets the blood supply. And it's very important that we take what's called a periapical. You can see the apices of the teeth to evaluate if the tooth has an infection. And if we see this little dark shadow here, we can go, oh, yep, telltale sign of infection, and we have to treat this tooth immediately. And it's usually not a fun day for the person, but it's important to get that taken care of real quick and get you out of pain. We also use x-rays to check up on our work or work done by other people. For instance, it would be crowns. These are some great fitting crowns. We look at the margin to make sure that they're fitting correctly. We look at the anatomy or the shape to make sure that's good. We look at the contacts, make sure they're not too tight or too loose. And just make sure that there's no extra material or there's any open spaces for bacteria to get into. We can also check if someone places an implant correctly, which this person did not. So unfortunately, bad implant. It doesn't meet the anatomy of the surrounding teeth, and it wouldn't distribute the force of the restoration or the crown on top, and it would not service the patient very well. So likely you'd need to replace that implant. So all these things are visually displayed through x-rays, and it's really important because it can give the clinician and the patient as well a clear understanding of what's happening in their mouth, and it's one of the best ways to find any kind of diseases, as I briefly demonstrated with those pictures. So as far as safety goes, nowadays dental x-rays are very safe, and out of any kind of clinical x-rays taken in a hospital or dental setting, the typical x-rays have the least amount of radiation. According to the American Dental Association, people in the United States are exposed to, on average, 3.2 millisieverts of radiation. How does that compare to everything? Your yearly checkup, if you just get 2 little bite wings on the side, that's 4 x-rays, exposes you to 0.005 millisieverts, and the full set of x-rays with the bite wings and the periapicals to show the roots, we take that typically 3 to 5 years depending on your health. That is equivalent to 1.6 millisieverts, or if you want to look at it in days of radiation, if your office is up to date on all the technology, they have digital and fast-acting x-rays. A full set, the 18 films, would be about 10 days of background radiation. That's not including your microwave, your phone, your foods that you eat, the granite countertops you have in your kitchen. That's just kind of everything surrounding you. So overall, they are very safe. If you have more concerns, such as you're pregnant or you have a history of cancer, then let your technician know, and we will go through extra precautions to protect you. But overall, very safe procedure, and they are entirely necessary to providing a good standard of care for patients. And hopefully that clears up some questions or misconceptions about x-rays, and I hope you have a good next visit at your dental office. Thank you.